Hey everyone, and welcome back to our Physical Therapy Masterclass Explainer. I'm your expert educator, Harshal. Today, we're tackling something absolutely crucial for both clinicians and medical billers. We're going to decode the nuances of clinical intent and documentation for two heavily used and honestly heavily scrutinized CPT codes, 9710 and 9712. Whether you're the one delivering the care or the one ensuring it gets compliantly reimbursed, nailing the exact boundaries of these codes is a total game changer. So, let's jump right in.
Okay, quick look at our agenda. We'll start with a broad overview of therapeutic procedures. Then we'll isolate CPT 971110, move over to CPT 97112, lock down our coding rules, and finally, wrap things up with a teaser for next time.
All right, Section 1, Therapeutic Procedures Overview, which really serves as our foundation here.
Now, pay close attention to the words clinical skills and direct one-on-one contact. Our source guidelines define a therapeutic procedure as a manner of effecting change through the application of clinical skills that attempt to improve function. So what does this actually mean for us? It means that unlike unattended modalities, like a hot pack or e-stim, a therapeutic procedure demands your direct, undivided clinical skill. You've got to be actively engaging with that patient to improve their function. If they're working independently while you're across the room typing up notes, well, you're no longer in the realm of a therapeutic procedure.
Plus, these codes, specifically the ones ranging from 97110 to 97150 and 97530 to 97546, are completely time-based. Since they're 15-minute timed codes, you have to strictly follow the CPT time rule. For Medicare and a lot of commercial payers, that means the 8-minute rule. So the exact times you spend providing these skilled one-on-one services, they must be rigorously documented. No guessing, no estimating. Every single minute you claim has to reflect actual skilled therapy time.
Let's move right into Section 2, Therapeutic Exercises, specifically CPT 97110. Okay, when your clinical intent is strictly about restoring a patient's raw physical capacity, this is your go-to code. CPT 97110 is all about correcting impairments by building up strength, endurance, range of motion, and flexibility. You can think of this as the mechanical foundation of the patient's recovery. For example, if you've got a patient recovering from knee surgery and that joint is stiff and weak, your goal here is to mechanically improve what that joint can do.
And what's really great is how flexible this code is. It applies whether you're working on a single body region or multiple areas. So whether you're taking a patient through highly targeted knee strengthening with resistance bands or doing broad lower back stretches to improve flexibility, 97110 covers it all. The key defining feature is simply that your intervention targets those core physical pillars: strength, endurance, range of motion, and flexibility.
All right, transitioning to Section 3, Neuromuscular Re-Education, CPT 97112.
Enter CPT 97112. This code is entirely focused on retraining the brain and the spinal cord when it comes to voluntary and reflex motor activities. You see, here, you aren't just building a stronger muscle, you're actually rewiring how the nervous system talks to that muscle. It's less pumping iron and a lot more like rebooting the mainframe. And that is a massive shift in clinical intent compared to what we just talked about with 97110.
If your notes show you're working on a patient's posture, balance, coordination, kinesthetic sense, or their overall spatial awareness, which we know as proprioception, you are squarely in the territory of neuromuscular re-education. Picture a senior patient with mobility issues who's a high fall risk. You wouldn't just hand them heavy dumbbells, right? You're retraining their balance and coordination to actually prevent those falls, and that requires the specific use of CPT 97112.
To hit these really specific proprioceptive goals, clinicians often use specialized equipment designed to create an unstable environment. Things like BAPS boards, Swiss balls, and trampolines are super common here. And why is that? Well, standing on a trampoline or trying to balance on a Swiss ball literally forces the nervous system to constantly adapt and fire off reflex motor activities just to keep the person upright. You're constantly challenging their balance and retraining their spatial awareness in real time. Okay, let's pause for a second because this next concept is absolutely crucial. If you want to avoid coding denials, remember this: your clinical intent matters way more than the movement itself. Let me say that again. The intent of the exercise dictates the code, not the piece of equipment you happen to be using. Our source material has a perfect example of this. Let's say you have a patient doing an exercise on a Swiss ball. If you're showing them this movement to facilitate dissociative movement between the lumbar and thoracic segments to improve their proprioception, you'll bill CPT code 97112. But if you have that same patient doing the exact same movement on that exact same Swiss ball, but your documented goal is to improve their functional ability to get out of bed, you're now using dynamic activities to improve functional performance. Because of that, you have to bill CPT 97530, therapeutic activities. The physical action might look identical to anyone watching, but your documented clinical intent changes the billing code completely. Mind-blowing, right?
Moving on to Section 4, Coding and Documentation Rules. Let's look at some best practices.
According to our billing guidelines, the time counted is the time the patient is treated using skilled therapy modalities and procedures. In plain English, this means you can only count the minutes where your unique expertise, clinical judgment, and decision-making were actively needed by the patient. If they're just resting between sets or casually pedaling on a stationary bike to warm up without your direct skilled intervention, you simply cannot count that time toward these time CPT codes.
Your notes have got to tell a complete, undeniable story. The medical record you submit should literally paint a picture of the patient's impairments and functional limitations that require your skilled intervention in the first place. You need to describe their prior functional level to establish a baseline and a prognosis. And crucially, your documentation must detail the skilled nature of the treatment provided and justify the medical necessity of the frequency and duration. You've got to prove, right there on paper, why an unqualified caretaker or the patient themselves couldn't just do this independently at home. To absolutely bulletproof your claims and keep those audit clawbacks at bay, explicitly document your exact time parameters. You need to clearly log the time code minutes, the overall treatment minutes, and the total treatment time to properly justify the units you're billing under the 8-minute rule. Also, don't forget to note any variables that influence the patient's condition that day. Did they have a sudden spike in pain or fatigue that forced you to alter your clinical decisions on the fly? Get that in the notes.
And we can't forget the golden rule of compliance that underpins all of this. You absolutely cannot initiate treatment without an evaluation. The ordering provider's assessment, the relevant medical history, and a certified plan of care must be in place before you start. Remember, therapy is a highly structured, medically necessary intervention, not just a casual workout session. Finally, Section 5. Let's look at what's coming up next.
We've covered a ton of ground today, clarifying the boundaries between therapeutic exercises and neuromuscular re-education. Mastering that distinction in your intent and your documentation, that's what separates the good from the truly great. But our journey through therapeutic procedures is far from over. Make sure to join us for Part 8 of this Explainer series, where we'll unpack aquatic therapy, gait training, and massage codes, and what it takes to build them compliantly. Until then, keep your documentation precise, and remember that clinical intent is absolutely everything. Ask yourself, is your current documentation leaving money on the table, or worse, inviting an audit? Keep refining those notes, and always decode healthcare with Harshal.